and we're obviously going to need an ophthalmoscope. And beyond that, we just need ourselves and your good memory. So I'm going to start out with the ear. I need oh, Lauren, okay. Good. Good.
Second
Now,
in the future.
okay, now I'll talk exactly how I would like you to describe your exam, okay? Hello. Now, I'm just going to introduce myself. My name is Margaret Johnson. Hello, and we're going to be doing an ear exam today. Now, the ear is elliptical. It's inserted at a 10-degree angle. I don't see any nodules or abnormalities. Now, let me know if this is tender or hurts in any way.
Nope.
So, there's no tenderness to palpation. Now, what I'm going to do is I'm actually going to do my ear exam now. So could you hand me the otoscope to your left and then turn that on for me, please? Yeah. Thank you. Okay. Ah, light. Okay. Now, I just wanted to show you that the cone actually screws on. It has a little elevated area, so this screws on. A lot of you will have the cone fall off or stay in somebody's ear, but that's always cute. Now, notice that I'm using my right hand and the handle is going up, and I control the tubing. Now, what I'm going to do is lift up and back, and I'm not going to just stick this into his canal. You have the best ears I could ever wish for. Yeah. Now, the angle of light is seen at 2, the malleus at, 5, malleus at 2, the tympanic membrane is pearly gray. It's perfect. Now, did that hurt? Was that uncomfortable?
No.
Okay, good. Now, I'm going to change hands as I go to the left. Now, what I can do here is I lift up. Now, ultimately, I want to point out that the cone needs to be directed toward his nose, very gently. So you go in so you can see where the canal is going. There we go. So here, the angle of light is at 7, the malleus at 10, and the posterior lobes are a little bit. Do you clean your ears with cotton tip swabs?
That's right.
I can tell. Now, it's not the plumber part here, but actually between 1 and 2 o'clock, you have a little area of erythema. It's as if you had an itchy spot and you went like this. Is that a possibility?
Usually after the shower, I always get water inside to clean the water.
Okay, there you go.
Stick in there.
Beautiful, beautiful tympanic membranes. That's all you've got to do. Now, the only test that's valid is a whisper test. So what we're going to ask Warren to do is, I'd like you to distract this ear by pushing the tragus in and out like this, okay? Now, will you do that now? Push the tragus in and out like that. The other ear. Now, I'm going to test on this side, and I'm going to whisper a phrase, and I'm sure Warren can tell me what it is. Let me try that again.
Keep doing it.
What did I say?
I didn't hear anything.
Okay, all right, just like me. Let's try it again. 4th of July. What was that?
4th of July.
Good for you, okay. So he's able to distinguish the whispered word at 2 feet, which is the whisper test. Not particularly sensitive, audiometry sensitive. So that's all there is to the ear exam. The trick for you is to get in and see something. So let's give it a shot. Then we're going to go to the eye